Hi, everybody. So my project was done in the community of San Pedro, area code 90731, at the local Boys and Girls Club. So the community of San Pedro has several health issues within the community. Two prominent issues are poor nutrition and substance abuse. Substance abuse leads to increased homelessness, decline in health status, unemployment, and increased crime. Poor nutrition is due to the high poverty rates. Members of the community often eat unhealthy, poor nutritious foods. This issue is important to be addressed because diet is a modifiable risk factor that can prevent the development of disease. So the LA Public Health Department found that there was over 70,000 substance-related arrests in 2008. Approximately 1,500 of these cases were juvenile cases. Students often report using substances. 37.6% of high school students reported using marijuana, and 7% reported using methamphetamine. According to a study, there's an increase in the individuals being admitted for acute overdose. The significance of this issue is an increase in hospitalizations, increase in violence and crime, decrease in health, increase in suicide rate, and increase in teen pregnancies. For poor nutrition, the CDC found that 59.8% of Californians are overweight, and only 1.7% of Californians eat fruit daily. Poor nutrition increases the risk for development of chronic diseases such as hypertension, diabetes, and heart disease. For substance abuse, Healthy People 2020 state that almost 95% of people with a substance abuse problem are unaware they even have a problem. The objective they have set is to increase the number of children and adolescents who say they have never used substances, disapprove of substance use, and perceive great risk associated with use. Healthy People 2020 also declared that it's a top priority to promote health and reduce chronic disease through the consumption of a healthy diet and maintaining a healthy body weight. The objective is to increase the number of people who are at a healthy weight, reduce the number of children who are obese, prevent weight gain, and reduce consumption of sugar and fat. So the needs of the community were identified through interviewing stakeholders. One individual who was a friend and former employee at a substance abuse clinic in San Pedro stated that she's concerned about the high amounts of people who struggle with addiction within the community. A local business owner and a paramedic were also interviewed. Poor nutrition was identified as an issue after interviewing several people at a local grocery store. One lady expressed concern about the prices of food and stated that she's unable to afford to feed her family healthy food because of the prices. She also said that it was convenient to feed her children and family fast food because of the convenience and how inexpensive it is. The pre-seed proceed model was the framework that helped guide this project. During the pre-seed portion of the project, the problem was identified, the desired result was identified, priorities were set, environmental factors and any barriers were assessed, and then policies that might influence the plan to be implemented were identified. During the proceed portion, the intervention was guided and implemented. The process to determine if the planned interventions are actually being done were evaluated. And then at the conclusion of the project, the ultimate desired outcome was evaluated. So there are several issues and barriers that interfere with the intervention project being implemented. Lifelong habits create stubbornness and barriers to change. And then it was obvious that some lacked the initiative or desire to gain knowledge on the issue. Within the community, There's a lack of affordable resources, difficulty accessing healthcare, and oftentimes a lack of community support. Personal barriers include a lack of support system, financial concerns, and a lack of health knowledge. In order to make changes, it's important to increase insight and awareness into these issues, educate people on how to handle these issues, and encourage them to make the necessary steps to make changes. During the substance abuse group, the Healthy People 2020 objective was used to guide the project, which again was to increase the number of children and adolescents who say they have never used substances, disapprove of substance use, and perceive great risk associated with use. So to achieve this objective, I educated the group on the physical effects of using substances, including the long-term health effects. I encouraged adolescents to attend after-school activities to keep them productive. I had the group practice problem-solving and communication techniques to assist them if they are confronted with this issue. I encouraged them to find healthy diversions from drug use, such as exercise and other productive things. And then I educated them on the available resources within the community. One intervention that I didn't do that I thought would be helpful if I were to do it again was to collaborate with community members who have successfully abstained from using substances to speak about their personal experiences. For the nutrition class, again, the Healthy People 2020 objective was used to guide the interventions. This objective, again, was to promote health and reduce chronic disease through the consumption of a healthy diet and maintaining a healthy body weight, and increasing the number of people who are at a healthy weight, reduce the number of obese children, prevent inappropriate weight gain, and reduce consumption of sugar and fats. So again, this project was done in a low-income community. So I really wanted to focus on educating children on healthy, affordable foods. I provided examples of snacks that they could eat after school. I introduced them to My Plate just to kind of educate them on portions of the food groups that they should be eating. I also introduced them to the BMI calculation and educated them on what a healthy weight is. So interventions that could benefit the community that were not done for this class were screen children for comorbidities associated with poor diet, such as high blood pressure, educate children on how to read food labels so they understand which foods are actually healthy, which foods are high in sugar, which are high in fat, etc. And then I thought it would be helpful to coordinate with the facility to provide additional educational classes regarding healthy meal prepping and other nutritional support. These are the handouts that were provided. Budget and logistics to implementing the interventions within the community include cost of employing RNs to work within the community, considering the budget of the county and community to employ these nurses, and then just the logistics of implementing these interventions. It takes time to organize and implement educational services within the community. So these are the outcomes that I used to measure my project success. The first one was, by the end of the teaching lesson, 75% would be able to identify one healthy, productive after-school activity to prevent using substances. This goal was not met. Over 50% of the class could name a healthy activity, but not so much 75%. I provided them with some ideas that they could do after school, but I informed them that going to the Boys and Girls Club is something that's productive and positive for them. The second goal was, by the end of the teaching lesson, I wanted 75% of the individuals to identify 3 health risks associated with abusing substances. This goal was not met. The class was able to say that using substances was bad for their health, but not 75% were able to state 3 specific health issues related to substance abuse. The third goal was 50% would be able to state 1 way to handle positive peer pressure to using substances. This goal was met. I had the class work with their neighbor to practice some communication techniques and create ideas about things they could say when confronted with peers on being asked to use drugs and alcohol. The fourth goal was 50% would be able to state 1 community resource available to them regarding substance abuse and addiction. This goal was not met. I informed them that there are clinics within the community and substance abuse meetings that they could attend for free. Yet when I asked them to recall this at the end of the lesson, they were unable to. For nutrition, I wanted 50% of the youth members to be able to calculate their BMI and determine the nutritional status as either underweight, healthy weight, overweight, or obese. This objective was not met and was possibly unrealistic on my part. Less than 25% of the participants were able to calculate their BMI. This was partly due to the fact that they're unaware of their weight. Those who are unaware of their weight, I still encourage them to practice using the formula, using a weight that they thought they were. And then I encourage them to find out what their weight is and then use the calculation at a later date. However, some of the individuals were unable to use the equation and unable to solve it. The second goal I had set was 50% would be able to state 3 cheap, nutritious snacks that they have in their own home. This objective was not met. Less than 50% could state healthy foods within their home. I encouraged them to encourage their parents to buy them healthy foods so that they can maintain a healthy weight. The third goal was 50% would be able to identify 3 foods that they eat that are unhealthy. This objective was met. I found it interesting that the entire class said that they eat fast food, but I wasn't surprised. By asking this question, it kind of opened the door to discuss unhealthy nutrients with the class. The fourth outcome was 50% would be able to identify 1 activity they enjoy doing that will improve or maintain their weight. This objective was met. The class was able to state some healthy activities such as playing outside and playing team sports. So in conclusion, unfortunately, less than 50% of my objectives were met. However, the community did gain knowledge on these issues. So at times it was difficult to keep the attention of the class. This could be because the class was filled with adolescents, or it could be because they were just not interested in the topic. There was also time limitation and language barriers while conducting the class. For the future, I think if I were to do it again, I would provide more handouts on topics presented, and English and Spanish copies for those who speak Spanish to share with those who also speak Spanish. And then again, I think it would be helpful starting the subject to have a outside. And that's the lesson.